Good evening, Dr. Ogwell. I hope you can hear me.
Yes, loud and clear.
Fantastic. So we are on a commercial break right now, and in the next few minutes we'll come to you.
No problem. I'm here.
Great. And just to confirm, your location is in Addis, correct?
That's correct.
All right. Wonderful. Thank you. Dr. Ogwell, so just a note as we're doing the interview, for you to look directly at the lens
Will do.
of your webcam. Okay, great. Thank you. All right, welcome back. Now, from a positivity rate of 2% in January this year to 22% this month, it's clear the COVID-19 pandemic is spiking by the day. Yesterday, 5 counties were put under lockdown to slow down the surge in cases that are now over 129,000. And it is not a situation that is unique to just us. Other African countries are experiencing the devastation caused by a third wave. In fact, the World Health Organization is warning this wave may overrun the continent's healthcare. Well, joining me now to delve deeper is Dr. Ahmed Ogwell, the Deputy Director at the Africa Centers for Disease Control and Prevention in Addis Ababa. Thank you so much, Dr. Ogwell, for joining us. Let's begin with the caseload that we're seeing and just the surge in terms of cases. So a leap of 50% in cases in the last 3 months across Africa. You know, what are you seeing in terms of the impact it's having on our healthcare systems?
Thank you, Victoria, for having me. The recent surge that we are seeing across the continent is putting a lot of pressure on the healthcare system, which, as it is, has been weak for quite some time. The need for critical care, for hospitalization as a result of COVID is pushing out the regular health care that we provide for endemic diseases like malaria and childhood illnesses. This means that if we can be able to control the COVID cases quickly, then we can go back to offering other healthcare services under an environment that is free of fear, because we will have controlled COVID. But the situation is very diverse across the continent, with some countries doing better than others. But generally, the healthcare system on the continent is stretched as a result of the increasing cases of COVID-19.
We've seen experts really concerned about a strain coming out of Tanzania, at least from what they've seen. Travelers coming from that country with a strain that is the most mutated that they've ever found of COVID-19. What more can you tell us about that?
Let's be careful. This particular new strain was first characterized in Angola amongst travelers who had come from Tanzania. Remember that Angola and Tanzania have a few countries in between them. So we are watching this strain very carefully. We are trying to find out exactly where it originated. We are also trying to see how it interacts with the population and with the vaccines that we have in the market. The important thing about mutations of viruses is that viruses mutate all the time. But the important variants that we look at as variants of interest are the ones that have an increased rate of transmission or cause more severe illness or can be able to withstand the current vaccines that we have. The strain that has been associated with travelers that came in from Tanzania is yet to be fully understood, but we are going to provide this information in the next few days as we continue to understand that particular strain.
And is it, at least from what you've seen so far, I know it's early days, is it more transmissible? Is it causing more mortality? What are the markers of this particular strain?
The key marker is that it's causing worry, but we have not yet reached that stage where we can say that it is more transmissible or it is causing more severe disease. We are not yet at that stage because it has been characterized in only a few cases of those travelers that came in from Tanzania.
Okay, let's talk about the frontline workers, very critical in this process of fighting COVID-19. WHO recently said at least 11 healthcare workers are getting infected by COVID-19 every single hour across the continent. Very concerning because we need their input in fighting the COVID-19 disease. But, you know, what should African governments be doing right now to further support frontliners?
There are three key things that governments in Africa need to do, and this is advice that we have given all the governments. The first is to provide our healthcare workers in the front line with appropriate protection. This is gowns that are appropriate, masks, gloves, visors, face shields, etc. We must protect them with appropriate personal protective equipment and appropriate training on how to use this equipment. The second is we must vaccinate our healthcare workers as soon as we get the vaccines. They should be the first ones to get vaccinated. It is extremely important to protect this group of workers. The final thing that we must do is we must continually build capacity of healthcare workers so that they know how to behave and how to conduct themselves in the context of COVID-19, whether they are working in a COVID ward or they are working in a regular ward, because we want their index of suspicion to be so high that they find themselves all the time well protected from anybody who may be at risk of having been exposed to this virus. We must protect these healthcare workers because we have very few on the continent, and governments must provide them with the appropriate working environment, including vaccination.
Of course, on the note of vaccination, many experts saying it's a bit slow in terms of how the exercise is going so far, at least from recent reports. Over 7 million people have been vaccinated across the continent, considering that we have over 1 billion people here. How do we scale that process?
As Africa CDC, we are aiming at vaccinating 60% of the African population. That is about 750 million people, the biggest vaccination drive ever on this continent. Right now, the pace is slow, and it is slow for two reasons mainly. One is that vaccines are not coming onto the continent fast enough, and secondly, that the systems that need to deliver the vaccines to the population have not been fully operationalized. And we are working with governments to ensure that they fully operationalize that system, from community engagement, providing good, correct, and timely information to members of the public, to ensuring that the vaccination centers are well manned by personnel, health personnel who know what they're supposed to do. That way, when members of the public go there, they do not need to wait for long. And finally, we need to have a way of ensuring that those who are part of the first batch of people to be vaccinated are the ones that go to the vaccination centers, not just a crowd of everybody and anybody going out there. We need to have a proper plan of who needs to go and when, so that we do not get crowding. Crowding by itself is already a risk factor, and we don't want the vaccination points to be a source of even more transmission of this virus. The pace is slow, but it is picking up as we get more and more vaccines onto the continent.
And you mentioned just that slow pace of actually getting them on the continent in the first place. We do know, apart from the arrangements made with COVAX and Gavi, there's also arrangements for private consignments of vaccines coming into the country. I know for Kenya, at least according to a local daily, the Russian vaccine is already at the port, and they're making arrangements for it to come to the capital and start, disseminating now that vaccine. However, it comes at a cost. So, what does this mean for a process that's supposed to largely be free when you start putting in private sector into the mix?
Our position as Africa CDC is very simple, that the COVID-19 vaccine is a public good, and our engagement with manufacturers and countries that are hosting the manufacturers is that we must have equitable distribution of COVID-19 vaccines. This is the first important thing. The second is that equitable distribution must also come into Africa. Whenever Africa CDC and the Africa Union, we secure COVID-19 vaccines, we distribute them equally across the continent. The third is that this vaccine at this stage needs to be free to members of the public. And the reason why it needs to be free is so that there is equitable access to the vaccine. Because everybody is at risk at different levels. The second thing that as Africa CDC we are clear about is that governments need to be in charge of acquiring and then distributing the COVID-19 vaccine. Governments must be in charge. And the reason why governments must be in charge is to ensure safety and importing the correct quantities of vaccine for a country. Now, if it is going to be that the private sector gets involved in acquiring and importing the vaccine, there are several risks here. The first is one of cost. The manufacturer wants to sell their vaccine as any other business person to the one who will give them the best price. Now, we are negotiating every day with vaccine manufacturers to keep the costs low. If the private sector walks in, they will be able to offer more, and it means access for African countries will be reduced. We are discouraging that kind of arrangement. On the issue of Kenya, two things I can be able to say about the vaccine that has allegedly been imported is that, one, it has not received any authorization, emergency use authorization by WHO, neither has it received emergency use authorization by the Africa CDC. I hope that there is a system within the Kenyan government of ensuring that emergency use authorization has followed the laid down protocol so that we know that what is being imported is actually a COVID-19 vaccine. Our position is governments must be in charge to ensure that the cost is free to members of the public, and we must have a system of ensuring that we get emergency use authorization for any vaccine that comes onto this continent. This we have communicated with all the governments in Africa.
And Dr. Ogwell, before I let you go, how much of a factor is the recent suspension of exportation of the vaccine from India in terms of how we get the vaccines here in Africa?
It's a very big headache for us because the Serum Institute in India was the backbone of the AstraZeneca vaccine, which was probably the largest portion of the vaccines that were going to come through COVAX. With that interruption, it has destabilized the plans that we had, the number of vaccines we had expected to bring onto the continent, and therefore provide governments to vaccinate its citizens. And we are in constant discussion with the government of India to be able to relax those restrictions so that we can be able to get those vaccines onto the continent. But at the same time, we are in a very advanced discussion with other vaccine manufacturers, and we expect that by the end of the weekend, we should be announcing other manufacturers being able to provide us with doses of vaccines for distribution to African countries. Vaccine nationalism is not good. Purchasing selling the vaccines to members of the public is also something that we discourage, and we hope that governments will take responsibility and ensure that members of the public are receiving these vaccines at no extra cost.
Fantastic. Thank you so much, Dr. Ogwell, for your insights and putting things into perspective from a continental view. And thank you so much. And